Good afternoon. The subcommittee will come to order. I want to welcome our witnesses to discuss the results of the Oracle Cerner EHR implementation at the Captain James A. Lovell Federal Health Center in North Chicago. Lovell is the first only fully integrated VA Department of Defense healthcare facility in the country. It's also the first large complex medical center where VA and Oracle have installed the EHR system. Secretary McDonough approved the go-live on March the 9th as an exception to the overall pause on the electronic health record modernization program that's been in place since October of 2022. That was despite the reset effort not yet producing any game-changing improvements, despite the VA pharmacy organization's objections, and despite the facility not completing its infrastructure improvements. The results at James A. Lovell tell us a lot. I want to thank Dr. Buckley for traveling here today to help us understand the reality of the situation. The reality is, this is the same system with the same problems that we have seen elsewhere. I commend Dr. Buckley and his team for how well they have managed the challenges, and I'm glad other parts of the VA have been able to flood the facility with the resources that are necessary just to keep the thing functioning. Their ability to work around the problem is commendable. But make no mistake, despite all the spin, the problems have not disappeared. And as a large, complex medical center, Lovell has revealed new flaws in the Oracle Cerner EHR. The committee staff visited James A. Lovell twice, and the employees are reporting the same frustration, hypervigilance, and burnout that the managers at the other 4 facilities testified about last September. They've managed to keep the doors open and provide care to the veterans and service members, but only with the support from more than 100 new staff and nearly 100 more on the way. In addition to the new staff, there were nearly 800 experienced users from other military treatment facilities, contractors, and experts from the VA central office pitching in immediately after the go-live. The pharmacy is completely reliant on outside help to operate. The Oracle Cerner pharmacy software functions so poorly that the permanent pharmacy staff can only process about 40% of the prescriptions. They're relying on the VA supplemental staffing unit to handle the majority of the workload. This has all been feasible at one facility, but no one thinks it's repeatable or sustainable. I have serious concerns that the Secretary McDonough is about to put the Department of Veterans Affairs and the veterans it cares for in a dangerous situation by resuming the go-lives on a large scale. If VA is not able to or willing to provide the same level of support they did for James A. Lovell at other medical centers, the result could be a disaster. Everyone needs to think seriously about that risk. The Oracle Cerner EHR is simply not good enough today to enable a bare minimum of efficiency at the VA, let alone the high-quality care our veterans deserve, without a huge influx of extra staff and money. Even before Ms. Duke disclosed that the Veterans Health Administration is facing a $12 billion budget deficit, the financial impacts of the EHR on the organization's staffing have never been budgeted or seriously reckoned with. You can see, we have known for 2 years that the VA's cost estimate is unlikely to hold. But despite everything that has happened, we still hear rosy predictions from the VA and Oracle, and no one has acknowledged the true cost from Mr. Cecilia and Dr. Adiron. They still are professing that this is going to be a $16 billion project. And we know it's not. We've learned from Lovell and the previous facilities that the expense to purchase and install the EHR is just the beginning of the cost. I have no doubt that moving forward with the system before it is fully functional and before the productivity and safety problems are resolved is the wrong decision. It is wrong for the veterans, and it is wrong for the VA employees. The Secretary is clearly no longer heeding my warning or this committee's warning. Therefore, the only responsible course of action is to lay out the true cost of finishing the Oracle rollout before the VA commits to it. Veterans and taxpayers deserve to know how large the Oracle Cerner bill truly is. Congress, as well as the public, need all of the information in order to make an informed decision about whether this is worth it and whether the inevitable sacrifices are truly justified. Anything less is a dereliction of duty. We will now proceed to questioning, and I will recognize myself for 5 minutes of questioning. Dr. Buckley, your facility is performing better with the Oracle Cerner EHR than the previous 5 medical centers. This seems to be because of your hard work and a lot of outside help, not improvements to the system. I understand you got a temporary support from nearly 800 people, and you're on track to add at least 216 staff at a cost of $26 million annually. Could you operate without these resources, and how would the system need to improve so you no longer need those resources?
Thank you, and I think that's a fair characterization and summary, but I will tell you, I think it's necessary for being the first site to go live in a couple of years, that we had those resources brought alongside of us to make sure it was as successful. We are learning that over time that the amount of staff that it will take does not appear to be quite as large as what you just quoted. I can't give you the exact number at this point.
So you don't have a request in to get an additional 100 staffers?
We currently have a total of well over 200.
But do you have a request in right now to get an additional 100?
Yes, sir. We have the authority to hire to that, but what I'm
So things clearly then, Dr. Buckley, okay, things are clearly not functioning exactly right, or you wouldn't have a request in for an additional 100. So could you currently operate without those resources, and how would the system need to improve so you no longer need those resources?
Well, I can tell you, yes, I think we could. I can tell you this.
Can you operate without those resources?
We cannot operate
Okay.
and to meet the needs of both departments to make sure we're delivering the care.
Okay, so
and
you could not operate without those
point.
resources,
That's
correct?
why we're asking for them, the authority to hire.
Okay, so what would need to change? What would need to improve so that you don't need those additional resources?
Yes, sir. So one of the things is over time, learning the workflows within the Oracle Health Cerner Federal EHR. That is a hard task, and that takes time, and that takes time for each facility. I think it'll, as we...
Okay, so how long are you anticipating you're going to need these additional resources?
What we're looking at right now, and I do want to talk about resources if I'm given the opportunity. So our staffing, one thing to be clear is while it may...
Dr. Buckley, this is my time. I've got 2.5
yes,
minutes,
sir.
so please, okay. How long are you anticipating you're going to need these additional resources?
I would say at least through the end of fiscal 2025.
Okay, so by the end of fiscal 2025, then, when we start working on the appropriation bills, then we're going to be able to make an adjustment so that these additional resources are not directed?
I think
And we're not going to hear complaints from you or your employees?
Well, I complain a lot.
Because I've got a chart back here where everyone was telling me that we're going to stay within the $16 billion, and we clearly aren't going to be able to do that. Dr. Buckley, you had 808 joint patient safety reports 3 months after Oracle Cerner went live. How crucial are these additional employees to mitigating the system's safety risks?
Well, I think the more focus that everyone has on being a high reliability healthcare organization, the better. I don't necessarily think throwing more staff at a problem is the solution.
Great, so that means we're going to be able to start reducing these staffing then.
In time, I
So
think
can we expect that you're going to remove that request for the additional 100 staff that you have outstanding now?
No, like I said.
Okay, so we still do need staff for that. Dr. Buckley, you described your facility's experience using the Oracle Cerner EHR to the committee staff as a pitched battle, but prevailing. What makes it a pitched battle, and how are you prevailing?
Well, I would say healthcare delivery is a pitched battle every day because we can never, ever be fully at the place.
Okay, but how about your facility with the rollout of a new software program? Why is that a pitched battle, and how are you prevailing?
Well, I would say that adoption of a new health record and a change of this magnitude is no kidding hard. It really is hard. But I think our staff know that the battle is worth it in the long run, that this is going to deliver the conditions for standardization that the VHA needs, and that modernization is something we need in order to reach standardization.
Thank you
I think
very
we
much,
need it
Dr.
in place.
Buckley. Ms. Duke, we're going to start talking math. As of June, Dr. Buckley was waiting for the VHA central office, presumably that's you, to release additional funding so they can hire the rest of the 216 staff that they've determined that they need. Sometimes we're being told they don't need them, but they can't function without them, so I would say that they need them then. Has that happened, and if not, when will it happen?
I believe the funding has gone out. If it has not, it will be by the end of the month.
Okay. Ms. Duke, several of the departments at James A. Lovell say that they need even more staff to keep their heads above water, particularly medical support assistants and pharmacists, which don't seem to be budgeted at all. Are you able to provide those resources?
So we would not provide those resources from the central office, but we are communicating with our VISNs to make additional funding available, but that is part of the identified shortfall that we've been in communication with you about.
So, Ms. Duke, conservatively, James A. Lovell is on track for a 7% staff increase so far to mitigate the Oracle Cerner systems impacts. And the Spokane Medical Center had to increase their staff by over 20%. If the system was rolled out across the whole Veterans Health Administration, based on the current payroll, that would mean between $3.5 and $10 billion in increased staffing costs, which is reflected here on this chart. That's on top of all the costs to purchase and implement the system. And that's just my back of the envelope math. But you need to know the amount down to the penny. That's what your obligation is. Have you done any study or estimate of those costs, and have you budgeted for them?
We have not done those costs at this time. We are working with the EHRM office on as we come out of the pause to ensure that we align our future resource requests with the requirements.
Will you commit to doing a study of the financial impact of implementing the EHR throughout the rest of VHA before the system is installed at any more facilities?
I will commit to working with EHRM office on identifying the resource requirements and aligning our budget requests accordingly.
Okay, well, we would really like to have those costs before we have conversations about rolling it out at other facilities. Ms. Duke, you informed the committee last week that VHA expects a $12 billion budget shortfall next year. Secretary McDonough testified in April that he plans to resume the Oracle Cerner rollout next year. How can you possibly justify introducing this disastrous system into more hospitals and diverting staff and resources when you're already in a serious budget crisis?
What I would say is that I will identify the necessary resources to implement the delivery of care consistent with where my organization chooses to go. And if we do move forward in 2025, we will look at the requirements and ensure that they are possible within the available resources that we have.
So we're already running a $12 billion budget shortfall in VHA. I'm trying to figure out where are those additional funds going to come from, because we already have the additional staffing requirements that we have seen. We see that on average, you've got somewhere between 7% and a 20% increase in staffing. Where is this additional revenue going to come from?
The identified shortfall that was communicated in part was in response to the recognition that we were not going to be able to achieve the lower staffing level that the original budget estimate had included.
I understand that. It's a shortfall. It's a $12 billion shortfall. okay? And when you already have that, I'm trying to understand how we're going to address. The EHR has thrown Vision 20 into a permanent budget deficit. And Vision 12, representative at Lovell, warned committee staff that they don't have the resources to support more than one medical center implementing the system over the course of the year. That's for the Vision. They don't have the resources to support more than one medical center. How much will resuming the EHR rollout cost VHA in 2025 and 2026? And how are you going to find the money to pay for it?
Again, I think I would echo Dr. Evans that the identified cost will be contingent on the identified plan, and that we would communicate our requirements in the 26 budget according to our practice to make sure that we're adequately resourced for whatever the plan ends up being once we do come out of reset.
So you're going to come back and ask for more money?
I think the other thing I would add is that though we fully acknowledge the staffing increases that have been necessary at the sites to date, we anticipate and our aim as we get better at using the system, as we increasingly standardize, as has been discussed, is to get to a point where we don't require significant additional staff in order to implement the system.
I understand that that is your hope, and I understand that that is your goal, but it is not reflective in reality, Dr. Evans, okay? With that, I have expired my time. I'm going to yield to Ranking Member Sheriff McCormick for 5 minutes questioning.